Hello and welcome to Extra Credit, the McAllen ISD podcast that takes a close look at programs that benefit you and your family. I'm your host, Ollie Perez, and today we are going to talk about our nursing program. My guest is the Director of Health Services for McAllen ISD, Elizabeth Gutierrez. Ms. Gutierrez, thank you so much for joining us.
Thank you for having me.
Absolutely, it's a pleasure. So, could you tell us a little bit about the role of a school nurse?
So the role of the school nurse is really intense. A lot of people think that they're sitting there with a Band-Aid waiting to hand it. But we do a lot to eliminate any obstacles in the education of our students, beginning with medical emergency plans with our students who have diabetes, who have asthma, seizures. The medical emergency plans are our physician orders that tell us how to handle those emergencies when they do arise on the campus. We do have state compliance that we have to meet, which are, immunizations and our screenings and, reports that get submitted. So, our end goal is to help the students be healthy so that they can learn in the classroom and succeed in life.
So, in McAllen ISD, you guys are able to provide registered nurses, that's correct?
Yes, that's correct.
Could you tell us the difference in the level of training of a registered nurse?
Yes, so that is so correct, and I'm so proud of that because not other districts have that.
Really?
Yeah, I come from a district where, in my previous employment, which were all medical assistants, I was the only registered nurse. So I'm so excited to have registered nurses in all my campuses. They do go through a rigorous program, and with a degree, an associate's degree in nursing or a bachelor's degree in nursing. Then, of course, from there they can move on. They challenge the NCLEX, which is a state exam that they must pass in order to practice as a registered nurse. So it is a little bit more intense, but they're able to do assessments, handle those emergency plans that I spoke about. Mm-hmm. And, anything that comes health-wise, we work real close with the county and, the conditions that happen.
So what are some of the campaigns the nurses carry out each year? Because I know there's a couple with vision or hearing.
So those are the state mandates that I spoke about also. We start the year off with our vaccines. The state vaccine compliance, the report is due in December. So I'm a big fan of immunizations, and McAllen ISD has been 100% in our state reports for the last 5 years that I've been here. So I'm proud of that. We do have our screenings, the vision, the hearing, the spinal or scoliosis screening, and the acanthosis screening. You probably went through those.
I remember taking those.
And those reports are due in June. But proud to say we've already submitted them in April. So all of those are done. But those are some of the things that are non-negotiables that we have to complete during the school year.
Oh, wow. So you like to get them done early and just leave them out the way?
Yes. For example, the scoliosis screening, we have two options. If we do 5th and 7th graders, we can do them by grade, but they have to be done by December. If we do them in January, then we're looking for age. And the age, the kids are in different grades, so it's a little bit harder. So I do push the grades, to do them by December.
So those are the only grades that they do it, because I think I remember I did mine in middle school.
Yeah, for the scoliosis, it's 5th and 7th grade for girls and 8th grade for boys.
Oh, okay. And so the other ones kind of the vision ones, is there any specific age range?
Yes. So for the vision, hearing, and the acanthosis, those are the pre-K, kinder, 1st, 3rd, 5th, and 7th graders, and anyone new to the district.
Oh, okay. So you do try to catch it early on if it
Yeah.
So how about the vaccination clinics? Because I know they do have a couple during.
Yes. Again, big fan of vaccines. So I've just scheduled the vaccines for the beginning of the year. We're going to have 4 end of July, early August. Okay, but I do hold those during the year. Mm-hmm. We just had one about a week ago. We had a great outcome. I think they did 65 vaccines for that. It was really, really a good turnout. But I do work with Hidalgo County to provide the vaccines for our students, family, and community. And then also our seniors. Our seniors who are going off to college in Texas require the meningitis vaccine. Yeah. So if they get that vaccine while they're still in high school, it can cost from $0 to $20. But once they graduate high school,
the price rises.
Yeah, it can go up to $200, the vaccine. Yeah. So I try to get those done. Work with the counselors to get those done for our students.
Guys, take advantage. You're saving money.
Yeah, it is.
It is really expensive, and I know it's a requirement for a lot of it is.
It is in Texas for the colleges, and it's a big savings for parents because all the expenses for the student to go to college, and you don't want to spend $200 on a vaccine when you could have gotten it for free.
So, could you tell us a little bit about the immunizations? Like, what is important for parents to know?
So, parents, speaking to parents, I think it's important that the students do get vaccinated. When I became director, we had 60 students across the district who had what is called a reason of conscience exemption, which is a state exemption that allows the student not to have vaccines. Those are good for 2 years, and then they have to get a new one, and then they notarize it and bring it to us.
Yeah.
We currently have 296 students in the district with that exemption, and where the rise happened was during the COVID years.
Oh, yeah.
So, I'd like to encourage parents to, reconsider and get the students vaccinated, especially with measles going around right now and stuff like that. That it's very important. When you do get your vaccines, save the record. And, you'll need it for registration or other things that you might do with your child that needs a vaccine record. But vaccines are very important.
Students, you kind of mentioned this already, but students going off to college definitely have to be up to date on their immunization.
Yes, they do require specific vaccines for a college level. And one of them is the meningitis, and that's why I really push for it. The cost and the need of the student. It's usually vaccines, where you see a change in vaccines is pre-kinder going to kinder, they're going to need vaccines, and 6th graders going into 7th grade need vaccines. So, as a parent, you think, okay, my child's up to date. Then you get to college and they say, hey, you need a meningitis, and you're like, what? So so I try to push that and get that ahead of them. So if they have it within the 5 years of college, they're good.
Well, okay. Yeah, I know. So you circling back to something that you said a lot of the vaccination clinics that they hold happen you had 4 planned out for the beginning of the year, even before school even started. Would these also be giving out meningitis?
Yes. Yes, I make sure that meningitis is in all the vaccine clinics and all the other vaccines. I do also bring in the flu and the COVID vaccines for people who want those.
Nice. That's really cool, actually, because I know, me personally, I'm struggling a little bit right now, scrambling to get my, you know what I mean? Because with college applications and stuff, all that, it is a requirement, and it does hold you back, even in certain schools, from applying to certain stuff like that. Yeah. So get it out of the way.
Yeah, even our students at the Collegiate Academy, they had to have the meningitis to be at the Collegiate Academy, and that was a requirement for UTRGV, yeah.
So they had to get a lot earlier.
Yeah, so I held events for them also, and we'll get it done.
Oh yeah, definitely will.
The Hidalgo County is really, really a great partner because I gave them 4 dates and they set it up and we're locked in, so we're good.
So when it comes to dispensing medicine to children, within schools, what exactly is the district's policy?
So medication administration of the school district is really, really it's really technical in the way that we have to have doctor's orders. We have to have the medication in its original container. Yeah. A lot of times you get so many pills and mom wants to divide them between home and school. We need the original container in the clinic. There is documentation that the parent needs to fill out, the permission slips and the consents. And a lot of times the physicians will allow the students to carry, for example, their diabetic medications, an EpiPen, or an inhaler. So there's more documentation there for the student that, like a contract with the student, you're responsible. Once you misuse it or share it, this privilege gets taken away and stuff like that. This year we did encounter something very, very different with medications in the summer right before school started, where the Board of Nursing made a call that over-the-counter medications were no longer going to be allowed. Before, mom can go and get ibuprofen, Tylenol, cough syrup, and bring it and sign the papers, and we would administer. This year, now we need is a doctor's order to go with that. So if you want to give your child anything, it's got to come along with a doctor's order. Yeah,
that's kind of rough. Actually.
And it's kind of the reason behind that is because as a nurse, we can't diagnose or prescribe. So if I'm just giving medication, that's exactly what I'm doing, diagnosing and prescribing. So we need the doctor to tell us what to do.
Okay. So, like, where would you say, like, parents, if they have any more questions, could they reach out for more information about your health services?
So, yes, they can go to the McAllen ISD website, go to departments and health services, and they'll see a list of all of our staff. They can choose their nurse from the campus, and when they click the name, an email will open up, and they can contact the nurse like that, or they can call or fax. And then, of course, health services department, there's 3 of us there who are always willing and ready to help the parent, and that's at 956-632-3275. They can call us, and they do. Parents do reach out, but for those who don't and need to, we're available and ready to help.
Well, there you guys go. If you have any more questions, feel free to reach out. Unfortunately, that's all the time that we have, but Ms. Gutierrez, thank you so much for joining us, and thank you for this information you shared today.
And thank you for having me.
Absolutely, it's been a pleasure. Well, that's Extra Credit for today. I'm your host, Ollie Perez, and thank you guys so much for watching.